Hello and welcome back to Aging Well, a monthly production of Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb, and our topic for this month is Medicare, which is a hugely important program, and we have Medicare Open Enrollment coming up in October, so we thought this would be a great time to talk about this program, which provides health insurance coverage for millions of Americans 65 and over and people with disabilities. As always, I have a couple of really awesome experts in the studio with us. We're going to introduce ourselves right now. Welcome.
Thank you. Thank you. My name is Corrine Lofchie, and I am an elder care advisor at Somerville-Cambridge Elder Services.
And you've been an outstanding guest several times on the show, and we're thrilled to have you back.
Oh, thank you.
And I'm Colleen Morrissey. I'm the resource specialist also at Somerville-Cambridge Elder Services.
And programming note, this is Colleen's first time in front of the camera, but she's actually done a lot of work on the show behind the scenes, so we're thrilled to finally have you here in front of the camera.
Same.
This should be exciting. So let's get the ball rolling. Let's talk a little bit about Medicare, which comes in several parts.
Yes, it does. So, yeah, we can just give a brief overview of how the parts fit together. So Medicare, the two original parts are called A and B, and A covers hospitalization, and B is outpatient care, and so those are the original. And then there's Part D, as in drug, and that covers prescription drugs, and then there's two pieces that are somewhat optional, or more optional, which are Part C, which are Medicare Advantage plans. And those are plans that are similar to kind of employer plans, where they're like HMO plans, where you have a network of doctors that you go to, and it covers as well. It also covers your prescription coverage, and that can replace the Part A and B.
When we give people an overview of the different parts of Medicare, we often describe it as two tracks, as you can either choose to do this Part C plan, which encompasses all of your coverage, or you can have your A and B coverage with a drug plan and perhaps a supplement. So we usually visualize it as two different tracks of two choices of how you want your coverage to look.
Yeah. So the Medigap, which you just mentioned, is if you do that track, it's a supplement that covers the gaps in Medicare. So Medicare covers for many services 80%, and then the Medigap would cover the other 20%. Yeah.
It sounds complicated enough that I'm really glad to know that there are knowledgeable people you can call at Somerville-Cambridge Elder Services for some help and guidance.
Yes.
And on some cases that would be you guys.
Indeed.
It would be.
Yeah.
So actually, and I guess that's kind of a good segue to our next segment, which is Medicare Open Enrollment.
Yeah.
For those who aren't familiar, can you tell us a little bit about that?
Sure. So when we're talking about Part C and Part D, Medicare Open Enrollment is the time every single year that you review either your Part C or your Part D coverage to make sure it's still the best fit for you. So that happens between October 15th and December 7th every single year. You can look through plans, determine if the format of your coverage. So if you want to stay in a Part C plan, you can look at other comparable plans, or you might want to switch back to a Part D plan. You review your coverage at that time, and it becomes effective January 1st of the next year. So you're looking at all the different parts, which we'll talk more about, of each of these kind of plans to look at them against each other.
And if you want to call in to do that, can you just call in and drop in, or is it the sort of thing where you need to make an appointment ahead of time?
You need to make an appointment. So yeah, the best way is to call our Aging and Referral phone line, our main number, and I know it'll be on the screen, 617-628-2601, and and you would say you want to, review your Medicare plans, and we would take some information about your situation and put in a referral, and you could sign up for a time slot to meet with one of the Shine counselors, and review everything with you.
Oh, that's excellent.
Yeah.
Sounds like something I'll definitely be doing when I'm getting ready to turn 65.
Okay.
Yeah, and it's something actually that we encourage people to do, not only when you're first enrolling in Medicare, but every single year. So a lot of times people think, okay, I'm already in a plan, I like how it's running. But a lot of times either there are changes to the plan. Each year they might up the premium, they might change what particular prescriptions they cover. So you want to make sure it's still the best fit, that there's not a cheaper plan out there for you. So we tell people to do it every year that they're in Medicare.
Absolutely.
Yeah.
Well, I think that wraps it up for our first segment. We'll be back in a couple of minutes with some more factors to consider with Medicare. We'll be right back.